She is a Master Science graduate in laser dentistry from RWTH University, Germany. She is a distinguished member of the International Society of Laser Dentistry, which as we know as ISLD. She is a widely recognized authority in laser physics and laser-based dental research. She has over a decade of clinical experience in dentistry. She is the pioneer in advancing laser technology in oral healthcare. Please welcome Dr. Malak Athamneh.
Thank you.
Welcome.
Thank you, everybody. Thank you.
Okay. Yeah, so here is a question for you. So the first one is how do laser compare with the electrosurgical unit and scalpels in terms of precision, cutting quality, and the tissue healing?
Okay, so the scalpel is actually a knife. So when we are using the scalpel for surgical purposes, we are traumatizing the tissue and we are asking our body to heal it.
Right.
Although when we are using lasers, the laser is, first of all, we are using a very, very tiny tips with micrometers.
Right.
So it's very precise. And at the same time, we have the light while cutting. There is light that penetrates deep into the deeper tissue that will stimulate and will regenerate the tissue at the same time. So you are cutting the tissue but stimulating at the same time.
I see.
So that will accelerate the healing and will regenerate the tissue without a scar formation. So it will boost the immunity of the host cells
I see.
to regenerate after you are cutting the surgical incisions.
Right.
That's comparing with the scalpel, but if you compare it on the other hand with the electrosurgery, the electrosurgery basically works on thermal energy.
Yeah.
So you are burning the tissue as well.
Right.
It's a big trauma for the tissue. You are heating it. And you asking the body, after traumatizing it, please come and heal.
Right.
Yeah. Although with lasers, you are having a light that cutting in very, very precise, minimally invasive, and biostimulation at the same time.
I see.
Yeah.
Okay, so you think that laser compared to all this kind of the equipment, it has better healing from the patient?
Yes, better healing and less complications.
Less complications.
After the surgical procedures, and at the same time, it's less painful because it will seal the nerves at the same time.
So what do you see about maybe the cutting efficiency?
The cutting efficiency is much better,
Much
because
better.
it's very precise. You are talking about tips in micrometers.
Micrometers.
Yeah, so the surgeon can be very, very precise and cut in minimally invasive techniques.
Okay, thank you, thank you.
Thank
Yeah.
you.
Then the second question is dental laser sometimes referred to as a high-tech anesthesia. So do you believe this label is justified based on your experience, or you think it is overstated?
Okay, so in my opinion, it's not a very precise name to call it like this.
Okay.
So basically the laser is an adjuvant treatment for all our dental treatments in the daily practice.
Right.
So I can say yes, it will support the anesthesia injections, but it's not an alternative for the anesthesia.
I see.
So the thing is that you can use the laser to help you make less painful injections. So you can use the photobiomodulation settings with the red laser to before you start to inject the anesthesia.
I see.
And then the patient will feel less painful, even they sometimes don't feel the injection because you already sealed the nerves but it's not an alternative for the anesthesia. So you can't call it a high-tech anesthesia. It's a high-tech, let's say, device that will help in multiple things, and it will help also in anesthesia.
I see. Yeah. So it's better call this like a, maybe I would say, it's a helper or helping the anesthesia instead of maybe to substitution.
Yes, it will enhance.
Enhance.
Yeah.
Gotcha. Oh, then maybe the third question is, are there any specific clinical scenarios or patient condition where you would advise against using laser? So what kind of the case is not suggested?
Okay, there is obviously all the time there is a development and new research going on, but until now the only two main issues that you can't use laser with is patients that have a photosensitivity. These patients actually they can't go to the sun as well. So it's very risky to use lasers with them. And the second thing, you are not supposed to use laser on these areas where there's malignancies.
I see.
So where is there cancer cells, you are not supposed to use the lasers. Other than that, the only contraindications is all of them are relatives. It depends on the dentist itself. The dentists are the one who's contraindicating things, but in general, from science, there is no contraindication except to these things.
Gotcha. So yeah, it's good that maybe laser can use for most of the patients.
Yeah, you can use it for the good thing about laser. The advantages, one of the advantages is that you can use it for pediatrics, for kids, and for adults at the same time, so it's at any age. And the other advantage is that you can repeat it. It's repeatable, so you can use it more than once. You can use it, for example, this week and repeat it on the next week at the same patient. So it's repetitive, and you can use it in any age.
Okay. Thank you for the insight on these questions. It's really helpful maybe for all of our audience to know better about the laser. Thank you.
Thank you. Thank you, everyone. I hope the laser future is yours.
Thank you.
Thank you.